So good afternoon, everyone, and thank you for joining us. My name is Ashley Dow. I'm the lead of the Jersey City Free Public Library College Readiness Team. And joining us today, we have the Hudson County Community College Exercise Science and Personal Fitness Training Program with Karen and Kathleen. And they will also be introducing the new public health program at Hudson County Community College today. So without any hesitation, I'm going to turn it over to Karen and Kathleen.
Thank you so much, Ashley. Thanks for having us. My name is Karen Hosick, and as Ashley said, I am actually the coordinator and an instructor of the Exercise Science Program and Personal Fitness Training Certificate Program at Hudson County Community College. And I'll be talking first about kind of those two programs. They're fairly new. We're really excited about it. Our enrollment just keeps increasing each year. So I'll talk a little bit more about those programs. Then I also want to introduce Professor Kathy here. She'll be talking a little bit at the end, but go ahead.
Oh, me, Karen, or you, Karen? Oh, okay. Just introduce myself. Hi, I'm Kathy Smith-Wenning. I'm Director of Health-Related Programs at Hudson County Community College. And welcome to our presentation on exercise science and personal fitness training. And then later on, we'll do just a little update on our brand new program in public health. Go ahead, Professor Karen, take it away.
Great. Without further ado, as I mentioned, I am an instructor and also the program coordinator. And I'll talk a little bit in just a moment about the difference between our two programs. But just a little bit of background on me. I've been at Hudson County for about 2 years now. Both of our programs are only about 2.5 years old, so they're fairly new. But we do have some graduates working out in the field. In the past, I worked as a professor at Montclair State University for a while. I have experience as a certified athletic trainer. I have experience as an exercise physiologist. I actually worked in an applied physiology lab with rats at one point in my life. I've worked as a personal trainer. So I feel like you name it in exercise science, I've done it. So I've seen a lot of different things. So I do bring a lot of that experience into the classroom. But some of the courses that I teach or have taught in the past are resistance training methods, aerobic training, exercise physiology, exercise measurement and prescription, program design and implementation, advanced personal training. And then I think the one that I love the most right now we're doing is internship and test prep. So we get to send our personal fitness training students normally out to an internship, but right now we're doing actually virtual internships where we meet with clients virtually. So it's a lot of fun. I will post this, or I will email this presentation to anyone who wants it, but you can always contact me at khosick@hccc.edu, or you can contact me in my office phone there. If you can't remember, you can always just go to the HCCC website and type in, exercise science or personal training, and you'll find one of us there, and we can direct you in the proper manner. So I'm a very visual person, so I thought it was fun to add some pictures of what we have going on in the lab that we've been going on in the past 2 years. So over here on the left, this top one looks a little funny, but that's actually what we're doing right now to keep everybody safe. We have plexiglass dividers between the person who's there on the bike. And then as you can see, there's a student just standing on the outside of another plexiglass divider, kind of hard to see there with the reflection. He's holding up a exertion scale so that the bike can communicate with us. As you can see, they're both wearing face masks. They're both wearing face shields. We do have a HEPA filter in our lab, which helps to circulate the air. So we're doing the best that we can in these current circumstances to make it safe for everybody, but still have a good experience. Right below them as well, you can see these are some of our students taking blood pressure, and because they're close, they're wearing the face shields and the masks. But all the pictures that I have here, the rest of them are in previous years before COVID, and some of the things that we've done. So this is measuring some, this middle picture here is measuring some blood glucose on the cycloergometer. This is our EMG system where we actually look at the muscle activity, the electrical activity of the muscle. This is doing a plyometric lab, and then this is doing a performance agility lab down here. So we have a lot of fun and cool equipment in our lab, and we definitely like to let our students use it. And the lab is the best part of our program. So just some nice visuals for our program. So the one question I get a lot of times before I even talk about our programs is, well, what can I do with a certificate in personal training? Or what can I do with an associate's degree in exercise science? And if you're asking that question, that's good, because you shouldn't be going to school if you don't know what you're going to do with that. So I've just listed off a few things. We do have two separate programs. We have the personal fitness training certificate. With that, a lot of our students are going on to be personal trainers. They may also work as group fitness instructors at the same gym they work as a personal trainer. Some of our personal trainers kind of turn it into a health and wellness coach business. Well, they do a little bit of personal training, but they also kind of coach on other health and wellness. With exercise science, with the associate's degree, most of our students use that as a stepping stone into a bachelor's degree. But we do have some students who are using their exercise science degree and are working as physical therapy aides right now. So they may be interested in going on to get a degree in physical therapy, but they want to make a little bit more money, or they want to kind of work on the side. So we do have some students that have finished their exercise science associates, and right now they're working as physical therapy aides. Or they also, once they finish their exercise science, they are working as personal trainers or health and wellness coaches. But you can do a lot. This is just, just a few things that you can do with a degree in this, but you can do a lot with just a certificate or associates. But if you're interested in going a little bit further, there are a lot of other opportunities for you as well in the realm of exercise science. So if you wanted to go on to get your bachelor's, you could be a strength and conditioning coach. So if you're really interested in working with high level athletes, if you wanted to work at a corporate fitness facility, you would need a bachelor's degree for that. But those jobs are really nice and kind of cushy because you get to work more regular hours. So if you don't like working at nights or early mornings or on the weekends, corporate fitness is for you, because you get to work 9 to 5, just like everybody else. And people come in to work with you during their kind of off time. If you're interested in doing physical education, you can do that as well. And you can start with your associates in exercise science. If you're interested more in nutrition, registered dietitian, you would need a bachelor's for that, but you could start here with an associate's. Cardiac rehab is another really big area that I think most people may not even know about, but cardiac rehab is doing exercises with people who have had a heart attack or other cardiovascular issues, and most of them have had some sort of surgery. And so they go through different phases. Usually at first they might start off in a hospital, but you can work as a cardiac rehab specialist in the hospital, or you can work in phase 2, phase 3, where you kind of phase people out of working in the hospital. If you wanted to go even further and get a master's degree or a PhD, you could also work as a clinical exercise physiologist. Clinical exercise physiologists work along with cardiac rehab. You can also work with patients who maybe have had strokes, or patients who are cancer, they're going through cancer treatment. If you're interested more in sports medicine, an athletic trainer might be a position that you're interested in. That does require a master's degree. If you're interested in physical therapy, the #1 undergraduate degree for physical therapy school right now is exercise science. Most students that are applying to PT school are going through an exercise science 4-year program before applying to physical therapy school. So again, another avenue if you're interested in doing that. If you're interested more in the physics of movement and the kinesiology, biomechanics, if you're interested in making braces or other devices for people, you could be a kinesiologist or an orthotist or a biomechanist. Again, that's usually a PhD. And then some people even use an exercise science background and then go on to be physicians, orthopedic surgeons, physician's assistants, chiropractors. So there's a lot you can do, and this can be just kind of your starting off point for your career in the future. Or it could be you really want to be a personal trainer and you need to get that certificate. So this is an option for you as well. So we kind of run the gamut, but this is a good place to start if you love exercise, but you're not really sure where you want to go with it. So let me talk a little bit about the 2 different programs that we offer. So the first is our personal fitness training program. Now it's designed to be a 1-year certificate program. So we would hope that you would come for 1 full year. If you started in this fall, you complete your first semester courses, and then in the spring you would complete your second semester courses, and you would have that certificate in hand by next May. Once you have that certificate, you can go to almost any gym, anywhere. You can advertise yourself online as a certified personal trainer. You will be hired very quickly, I can guarantee, especially as we start opening up restrictions from COVID, because a lot of people are saying, wow, I really didn't do much the last year and I need someone to help me get back on track. I'm already hearing that now, and it's only going to be more and more apparent in the next year or so. The personal training certification that we use is with the National Academy of Sports Medicine, or sometimes it's abbreviated as NASM. We use this certification because it's extremely well known in the fitness field, in the fitness industry. There are some different types of certifications you can get, but if you ask any gym, they'll say, well, what type of certification do you have? And if you say NASM, they say, that's the best. That's what I want my personal trainers to have. And I actually had a meeting this morning with someone who contacted us because they found our information on the NASM website and said, you train personal trainers and they get their NASM certificate. I want, after you train them, I want you to send your students to me because that's what I want. I want NASM certified personal trainers. So with our program, we do, again, you would sit for that exam. It's included in the price of tuition. And we have a 100% pass rate right now. Okay? I like to kind of brag about that a little bit, but we really do well to prepare you for the exam. Okay. So that includes an internship. And as I mentioned, right now we're doing virtual internships, but hopefully starting in the summer, we'll be doing more in-person internships again. The internship site we have currently is with Newport Swim and Fitness. It's a beautiful facility right on the waterfront. And we have a really, really great connection with the head personal trainer over there. He really mentors our students, and they've hired 2 of our students since working through there with their internship. And with that course, again, you also get a test prep course with me. Now I am NASM certified. I've actually taken the test twice because I let my certification lapse. So I know exactly what's on that exam, and I will help to prepare you for it. That's part of the reason we have such a good pass rate, because we know what they're going to be asking. So if you're interested in being a personal trainer at all, or you're like, maybe I'm not sure, what I would suggest is starting with the personal training certificate. And then as you learn more, if you're like, wow, this is really cool, I want to keep going, I might want to get a bachelor's, I might want to get a master's, then you can take that 1-year certificate and easily transition it into our 2-year associate's degree in exercise science. So if you're unsure, if you think there's any reason that you may want to continue on with your education, or you may want to train clients on the side while you're continuing on with their education, I would say start with the certificate, and then we'll easily transition you into the associate's degree. But let me show you what that looks like, the 1-year certificate program, the courses that you would be taking. So the first semester, as I mentioned, ideally it works best if you can do this all in 1 year. But if you have to take things part-time, that's okay. We suggest taking either human biology or anatomy and physiology. Now, I will say this, if you think you're going to use this as a stepping stone to your exercise science associates, take the anatomy and physiology, because you will need anatomy and physiology for your associate's degree. If you're thinking, I'm only going to do this for the certificate, absolutely, then you might be safe taking human biology. They're both challenging courses, I will say that. But if you have any thought you might continue on after just a certificate, take anatomy and physiology, because then you won't have to be taking extra courses if you decide to continue on. Then the other course, a general ed course that you would have to take, is either college composition or speech. If you decide to transition to exercise science, you need both of those anyway, so you can choose whichever one you want. If you love to give speeches, you could take speech. If you say, I hate public speaking, I'd rather just write, you can take the college comp course, English 101 course. So those are your 2 gen ed courses. But then after that, the rest of the courses are really going to be in-house with myself, and we do have 3 adjunct instructors. So you would either be having me, or you'd be having Professor Alberto, or Professor Peach, or Professor Soros. He's our new professor. He'll be teaching in the fall. So we had Professor Silva Pfeiffer. She just left us, so sorry about that. But so you will have one of us. Oh, I'm sorry. We have
Awesome.
Shema, yeah, who also teaches our sports nutrition. So actually we have 4 now. But these are the courses that you taking with us. So we have a Foundations of Personal Training class. You would be taking resistance training methods and aerobic training. And those courses are also required for exercise science. So again, if you took these and then decided to continue on with your exercise science, check, check, you've got those checked off the list. Sports nutrition is a elective for our exercise science major. So if you took that, again, check, that would be one of your elective courses. Health fitness management, that would also be an elective choice for exercise science. You could check that off the list. The advanced personal training class is one that doesn't kind of transition over into exercise science, but this is the course where we're really going to really teach you how to be a personal trainer. And a lot of the other little ins and outs that you may not learn in some of the other courses, and a little bit more depth into the science. We'll talk a little bit more about the physiology. We'll talk a little bit more about the biomechanics in that class. The program design and implementation is a course that you would also take with exercise science students. So that's another one. Check would transition into your exercise science associates if you're interested in. And then the last, internship test prep, that's where we really prepare you for to sit for the exam, and you get to go out into the field and work as a personal trainer. So, and I see Jeremy, you're in here. If you have any questions, feel free to type them in the chat or stop me. But that's in a nutshell, kind of our personal training certificate program. So maybe you're not interested in being a personal trainer. Maybe I'm going to use this as a stepping stone to go and be a physical therapist or an athletic trainer or a strength and conditioning coach. If that's more your cup of tea, then you're going to want to do our exercise science 2-year associate's degree. Now, again, if there's any doubt in your mind or you're not really sure, I would say start with the personal training, because you can always transition into the exercise science and you're not going to lose any time. But if you know for sure, or maybe you already have your personal training certificate, we have some people who are already personal trainers, but they realize they want a little bit more education. So they come back and do our 2-year associate's degree. With this course, you're going to get some similar courses that you had with the personal training, but you're also going to get a lot more general education courses, which I view as a good thing. The more well-rounded you can be as a person, the more relatable you're going to be as an exercise scientist. And this is definitely a people person career. It's a helping career. So the more well-rounded you can be, the better off you're going to be. But I just want to stress on here, this particular program does not include a certification exam. It does not include an internship. So if you are interested in getting a personal training certificate, or you want an internship experience, do the personal training certificate. That's where you're going to actually get that experience. But this program, again, is really designed to prepare you for a career in exercise science. Maybe you want to be a health and wellness coach. Maybe you want to be a physical therapy aide, or maybe you're interested in transitioning to a 4-year institution. And I am excited to say just this past spring, we have finalized a dual enrollment and transfer agreement with NJCU. So New Jersey City University are right in our backyard. So if you're interested in staying in the Jersey City area and you want to transfer to a 4-year degree, you can take all of the credits that you earn here and take them right over with you to NJCU, or even better, you can enroll in both programs at the same time, and you have access to their library, you have access to their buildings. I'm still trying to confirm if you have access to their gym. I don't know if I keep getting mixed answers, but you might be able to do that. So you can also do a dual enrollment program with NJCU and Hudson County as well. So that's another kind of perk that we have with them. So what would this look like? Again, if you were to go full time, it would be 4 semesters. The first semester, you're taking a lot of the kind of general college education courses. So you can see there, but we do have an intro to exercise science class the first semester. And that's a great class to just introduce you to all of the different things that you can do with a degree in exercise science. Second semester is where you're going to get a little bit more into some more of our classes. You'll take that resistance training class and the aerobic training class. And again, if you already did your personal training certificate, check, you've already done those. If you've done anatomy and physiology, check, you've got that. If you already did your college comp, so you can check all of those off the list and kind of start as a second year if you did your personal training certificate first. Once we get into the third semester, you do get into a little bit more of our heavy science classes of biomechanics and exercise physiology. I'm not going to lie, these are a little bit challenging, but they are really, really cool. And we do have some cool equipment that you'll get to see in the lab. As I mentioned, that EMG we get to use with biomechanics. We do the blood lactate, blood glucose with exercise physiology. And then the fourth semester here is where you have to you can fill in anything that you missed. You have a little bit of elective in what you want to do for exercise science. And then you do have some electives in general ed. So a humanities or social science elective, diversity elective. And this exercise measurement prescription class, it's a 4-credit class. It's a lot. And this is where you really learn how to, if you have someone standing in front of you, how do you assess them? And then how you design a proper training program for them. So that's what that class is all about. And I will say the major elective choices down here, that's going to depend on what your goals are. If you want to transition to NJCU, we say you have to take the sports nutrition class, and then you also have to take the principles of athletic injuries class, because those two courses will transfer over. If you're interested in going to Montclair State University, I know some of our students are there, we would recommend taking the health and wellness course and taking the principles of first aid course, because those courses transfer over there. So once you kind of get to that point, you definitely want to communicate with me, or you want to communicate with the academic advisors, and we can kind of advise you on what choices you might want to take for your electives. But that's what it kind of looks like for the associate's degree. The other thing I just wanted to say is, if you are already gung-ho, hopefully I've maybe sparked a little bit of interest in you, and you're like, where do I sign? How do I get started? We are offering some classes this summer. And as I mentioned, it's great if you can come full time, but we understand a lot of people have to work and they do this part-time. So if you want to kind of get a leg up, if you know you can only do part-time in the fall, take a class or two this summer to kind of get ahead a little bit, so you don't feel like, oh my gosh, I have so many courses to take each semester. So we are offering some classes this summer. So summer session 1 on the top there runs from May 24th to June 30th. Summer session 2 runs from July 13th to August 18th. For some of our gen ed courses, those are offered during both summer sessions. So we have anatomy and physiology, human biology, the student success course, college composition 1, college algebra. Those are all offered during both summer sessions. So again, if you were a real go-getter and you said, okay, I'm going to take my anatomy and physiology and my college algebra during summer session 1, and then I'm going to take my college student success and college comp during summer session 2, you're going to come in already almost completed your first full semester. So again, I don't expect everyone to do that, but it is a possibility. And then we are offering some exercise science specific courses during summer session 2. So, and I say exercise science, I apologize because that's our little misnomer there, but if you're a personal fitness training student, you could also take those courses during summer session 2. So our resistance training methods course and our aerobic training course. So again, if you're interested, you could start already this summer taking some courses. So the next, so if you're looking for more information, or you just need, you're not quite sure, or you want to meet me in person, you want to pick my brain a little bit, I will be at an open house. We are having an outdoor open house, but on site in Journal Square on May 1st. If you would like to come to that, just please make sure you register ahead of time, because we do have 2 separate sessions and they do fill up quickly. So you want to make sure you register ahead of time for one of those sessions. Or maybe you're interested in this, but you're also interested in nursing, or you're also interested in public health, like Professor Kathy's going to talk about. That would be a great way to come and kind of feel out some of the different programs that we offer here. If you're not so sure if you can afford it, or you have questions about financial aid, I put the link up there. We have some great people that work in financial aid, and they can answer all of your questions. If that NJCU dual admission thing sounded really interesting to you, you can click on the link there, and that will tell you a little bit more. You basically just have to fill out one application for both schools. If I've sold you and I've really done my job and you want to come and work with us and you're ready to apply, you can click on that application link there as well. And as I said, I can send this PowerPoint out to you. But that's really all I have to say about the 2 programs, and we'll take a little bit of time at the end for any sort of questions that people might have. Ashley, is anyone posting any questions or comments in the chat?
I don't see anything, Karen, not yet.
No, not yet.
Okay, no problem. Then what I will do, and I do see Jeremy, I don't want to put you on the spot here, but do you have any questions about exercise science or personal fitness training? Okay,
Okay.
perfect. Thank
Got
you.
it, Jeremy.
All right, so I'm going to pass it on to Professor Kathy, who's going to talk a little bit about our new exciting public health option program.
Hi, everyone. We have, I'm Professor Kathy Smith-Wenning. My background is as a registered respiratory therapist, and believe it or not, I'm also a medical anthropologist. So I have two parts of my brain and they kind of operate simultaneously. So that's why I love, part of the reason why I love public health so much. Now, interestingly enough, public health might be for those of you who don't really want to touch anyone yet, right? You don't want exercise science. You may not want nursing, or you want nursing, but you want to collect, your mission is to collect credits that you need to go on maybe to a bachelor's degree. So public health is a great place to begin your degree in a public health field. This is a great time to be involved in public health. We've got the pandemic going right now. We're all interested in the health of our community. One item or one buzzword you've heard a lot over the past year are health disparities. We've known for decades about health disparities when the dominant main population has better outcomes than smaller populations do within a community. And you can work to help reduce health disparities. So let's talk about what you might do with this, or what you will learn. So get ready to improve the lives around you, of the people around you, through a degree in public health. What will you study in public health? You will study infectious disease. You'll study the infections, the disease itself, the transmission. How do you stop the transmission of a disease? And vaccines. Vaccines are a huge part of our lives today. We will look at chronic diseases such as diabetes, heart disease, sickle cell anemia, and other chronic diseases. So we'll look at the prevention and the treatment. And as a public health professional, you can become involved in the health promotion of public health to reduce the disease and to make lives better for the people around you. One that I'm really interested in is environmental health. We need clean air and clean water, absolutely, to reduce health disparities. That goes into social determinants of health, which you will begin to study. But through a degree in public health, you begin to look at the environment much closer, and you begin to understand air quality, water quality, noise pollution, and also a reduction in tobacco use and what tobacco smoke or other types of smoke in the environment do to the people who live within these environments, in these smoky environments. You could, for instance, get involved in occupational safety, which includes, no matter where you work, there are occupational safety codes. If you work in a kitchen, there's certain behaviors and there's certain equipment you're supposed to use. So as an employee, you are safe. And as a public health professional, you would come into a place such as a kitchen or a workplace or a warehouse, and you would begin to identify unsafe conditions to make the place safer for the employees. You could be involved in family health, which includes mother-baby health. You could work to reduce infant and maternal mortality and morbidity, which means illness. Believe it or not, New Jersey actually has a high rate of infant and maternal mortality, and that means more babies die in New Jersey before their first year of life than in other states. So there is a gigantic initiative right now, spearheaded by Governor Murphy's wife, Tammy, just in this area of infant and maternal mortality to decrease those rates. Women do die right around the time they have a child. So we're working hard in the state to reduce those rates. Now, there are all these areas that you could study to help make your community safer. And once again, we also in the public health degree have agreements with New Jersey City University, NJCU. We've got the articulation agreement, which once again, like exercise science, makes it an easy transfer to get that bachelor's degree in public health. We also have dual admission, and at the same time, you could be a Hudson student and an NJCU student and use the facilities over at NJCU. And the last slide, we'll just take a quick look at the curriculum. There we go. I hope you can see this. General education is somewhat the same, but if I go over to the major requirements, many of these courses are under construction, but I recently wrote the global health course, which I think for me is really cool. I've done a lot of work in Oaxaca, Mexico. That is spelled Oaxaca. I work with indigenous communities in Oaxaca. So the global health course, we've got consumer health, pathophysiology, which is a disease course, environmental health, obviously, we just talked about that. Healthcare navigation, I think, is going to be a really good tool. We can teach you some skills for contact tracing. What do you do when there is a disease outbreak? And it's not just COVID. There could be a meningitis outbreak or foodborne illness. We can teach you how to contact trace what happened. Then I also teach the culture, diversity, and healthcare course, being that I've worked in many different cultural areas and being an anthropologist. That's one of my favorite courses. And then an introduction to healthcare. What is it? What are the systems that you need to interact with? And then we do have a service learning internship. And I think this is very helpful for you to begin to learn about the different organizations in Hudson County. You know what? Maybe one day you can go work for them in one capacity or another. And as Professor Hosick said, we are available for any kind of questions. We will both be available Saturday, May 1st at the open house. And believe it or not, many of the students in my culture, diversity, and healthcare course, many of them are currently medical assisting students. And we will be at the vaccine information table answering your questions in English and in Spanish. So we are there to help. And if you become one of our students, you will be with us out in the field creating better health opportunities for the people of Hudson County. Thank you very much. And if you have questions, I think you know where to find us. Thank you, Long Branch, excuse me, not Long Branch, I live in Long Branch. Thank you, Jersey City Public Library. Go ahead, Karen, I'll let you close. You're muted, my dear. Usually me, it's usually me.
So I think, let me just go back a few slides again to where I had some of those
There we go.
information. If you need more information, you know, I can send out this PowerPoint, but you can always just go to hccc.edu, type in any of those things, type in exercise science, type in personal training, type in public health, and you should be able to at least get somewhere close to the right place, and someone can direct you where you need to go. But we would love to see some of you at the open house. If you have any questions, and thank you again, New Jersey City Public Library for hosting this for us. And we hope to continue this in the future each semester and get the word out that we want to get Jersey City to be more active and healthy. And that's, I think that's Professor Kathy and I, we feel like we just want to do that. We just want to embrace Jersey City up and moving and healthy. So, thank you so much.
Jersey City Library and everyone who attends.
Thank you so much, Karen and Kathy, for your time today. This session has been recorded and it will be posted to YouTube within the next week.
Okay.
So if you did not catch it today, stick around. A link will be posted on Facebook to the recorded version. I want to thank you all again, and I'd like to invite you guys back for our Health Sciences Week in May.
Oh, that would be great.
And I will send you more information about that tomorrow morning. So thank you again to our presenters. I don't see any questions in the Facebook Live comments. So we're gonna end the live stream. Thank you again. Have a good rest of your afternoon, everybody.
Okay, we'll hope to see you in May. Okay,
Yes,
bye.
absolutely.
Okay.